before we answer who is legally allowed to prescribe medications, let's look at what it really means to prescribe. Most people think that prescribing is just writing the name of a drug on a piece of paper, but in medicine, it's more than that. Prescribing is the legal and clinical process of deciding that a patient needs a specific medication and taking responsibility for that decision. And that decision begins before the prescription is even written. First, the healthcare professional has to understand why the patient is even sick, and that means taking a detailed history, performing a physical examination, and when necessary, requesting and interpreting laboratory tests or images. Once the diagnosis is made, the next question is, does this patient even need medication? Because not every illness requires a drug. Some conditions are treated with lifestyle changes, physiotherapy, counseling, surgery, or simply observation. If medication is needed, the prescriber then has to answer several other questions. What drug is the most appropriate? What dose should be used? How often should it be used? How many days should it be used for? Can this drug interact with other medications the patient is currently taking? Is it safe in pregnancy? Does the patient have underlying liver or kidney problems that will require a dose adjustment? There might be others that I did not mention, but after answering those questions, then you can write a prescription. So now to the question of who is legally allowed to prescribe, the answer depends on the laws of each country. In many countries, including Nigeria, medical doctors are the primary healthcare professionals that are licensed to independently diagnose illnesses and prescribe medication. In other countries, specially trained nurse practitioners and pharmacists can prescribe under laws that define how they can and when they can do so. The key point is this: prescribing is not just about knowing drugs, it's about making a clinical decision, accepting legal responsibility for that decision, and being accountable for the patient's care. So if doctors are to prescribe drugs, then why do pharmacists still review the medications that have been prescribed by doctors? That's where my next video comes in. Stay tuned and thank you for watching.